The numbers are shocking. In the next 24 hours, over 5,000 new cases of diabetes will be diagnosed. 24 hours, 5,000 cases.
That's amazing.
Huge.
It's epidemic around here. The end of National Diabetes Month is here, so it's still the perfect time to raise some awareness about a growing health hazard. Dr. Daniel Wendorf, the president of Mount Carmel Health Partners, is here to give us a test to find out how much we know about diabetes. Good morning.
Good morning.
All right, try us out, because this is, when we talk about those kind of numbers, that's enormous. Is that up from years past?
No, that's about what it's been.
Really?
Yeah.
Like a steady number for a while.
It's pretty steady. Yep.
Huh.
So something we really need to do something about.
Right. Well, and I guess the more you know, the better off you can be.
Absolutely.
Because many of these, much of diabetes is what, type 2 that you can actually prevent?
Correct. That's right.
Okay.
Yeah.
So
was
if
that
it's
an answer that I got right?
Yeah.
No, well, not yet.
Okay.
Okay, let's try it. What do you...
Okay.
Yes.
First question. You're more at risk for diabetes if someone else in your family has diabetes.
You're more at risk for diabetes if someone else in your family has diabetes. I'm going to
go
say...
with true.
True.
Absolutely right.
Ding, 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 ding.
Family history is one of the many risk factors for type 2 diabetes. Other risk factors would be being overweight, inactive, or a low level of the good cholesterol HDL in your blood test would also make you at risk for developing type 2 diabetes.
Now, all of those things can be part of your family behavior, and I mean, not just the genetics, but family behavior and how you're running your household.
Yes, diet and exercise and things like that can alter those risk factors so that you can decrease your likelihood of having diabetes, even if there is a genetic predisposition by having it in your family.
All right. Try us again.
Okay, question 2.
Okay, question 2. You'll know you have diabetes by your symptoms.
You'll know you have You know you'll have diabetes by your symptoms. True or false? I'm going to say false.
Yeah, because you may have some symptoms, but
not all.
You may not know exactly what it is.
You guys are on it. That's right. It's false. Many patients are asymptomatic, although the classic symptoms of drinking too much, being thirsty all the time, being hungry all the time, those things are definitely there. Not all patients get them, and not all patients get all of them. So as many patients are asymptomatic, and so you shouldn't feel like, well, I don't have any symptoms, so I must not have this. You need to be checked.
You need the blood test. Blood test to find out.
Absolutely.
Okay. Question 3.
Question 3. Diabetes is caused by eating too much sugar.
Oh, that sounds like a trick question.
Diabetes is caused by eating too much sugar.
You know what? I think it's probably multiple causes, so I'm going to go with, because we talked about it could be genetic. So I think it's sugar plus other things.
I'm going to say true just to be a rebel.
Well, and the answer is false, but I think we should give credit for true, because if you eat too much sugar, that is a dietary problem.
Doctor, you're the best.
So I think both are correct. Although just eating sugar is not the answer. It's eating you want to eat a regular diet and with moderation. So you want to eat a healthy diet, get regular exercise.
Once you're diagnosed with diabetes and you decide that you're going to do something about it, can you essentially minimize the symptoms with diet and exercise to the point that it's almost like not having it, or will you always have it?
You'll always technically have it, but you can control it with diet and exercise alone, even without pills in some cases.
Okay.
Now, it is a progressive disease, so you may not always be able to do that without medications, but you can definitely make things better and decrease your chance of complications.
Wow. Really quick, last question.
Last question. Women who have gestational diabetes once are more likely to develop it again in another pregnancy.
Women who have gestational diabetes
This is diabetes in pregnancy.
I'm going to say true on that.
False.
No?
No, true is the answer. You're two times out of 3 next pregnancy will also have gestational diabetes if you have it with the first one. Gestational diabetes is also a risk factor developing type 2 diabetes in the future.
Amazing. Thank you so much for helping us out.
My pleasure.
Yeah, thank you.
Dr. Dan Wendorf, we appreciate your time this morning.
It's my pleasure.
Thank you for giving us a little education. How do we do?
You won.
Woohoo!